Human coronavirus OC43 associated with fatal encephalitis. Catholic University, presented by Gabriela Matute Tobón. Definition. Encephalitis is a serious neurological syndrome characterized by brain inflammation that may be fatal, and now the majority of cases are caused by viruses. The identification of a causal organism can be difficult. Encephalitis that affects patients with immunodeficiency is particularly challenging to diagnose. Since the clinical presentation may be atypical and the differential diagnosis may include unusual parentage or annoying cases.
In this video, we're going to talk about
Application in nursing. Deep sequencing of clinical samples has the potential to identify in the pathogens associated with encephalitis, particularly in cases in which traditional techniques have not identified the candidate causative pathogen. In these studies, it may have shown that HCOV OC43 can infect neurons and cause encephalitis.
Roughly 10 years after the SARS epidemic, a novel respiratory virus was isolated in Saudi Arabia. This new pathogen, the Middle East respiratory syndrome-related coronavirus, MERS,
Pros. Deep sequencing of biopsy material provides an important tool to the diagnosis of unexplained encephalomyelitis, particularly in patients with immunodeficiency who have undergone stem cell transplantation, where the differential diagnosis may include immune-mediated inflammation or drug toxicity.
Symptoms of viral encephalitis. This is inflammation of the brain. Some of the symptoms would include fever, headache, poor appetite, loss of energy, and a
Cons. The human beta-coronavirus, including HCOV-OC43, are predominantly associated with respiratory tract infections. The group includes viruses that causes the severe acute respiratory syndrome and the Middle East respiratory syndrome.
ask you a question. What if you didn't have to die? Encephalitis, Gumview, Voltrex, or any other cyclovir medication again? Sounds impossible? I thought so too, before I discovered a big lie, big pharma.
Encephalitis in Ecuador. Every 2 years there is a spike in the number of children infected by disease, but this year is being unusually high, said Dr. Jojandra Prasad, head of Health Gadak district, where more than 150 children have contracted encephalitis.
Hi, today I'm going to talk about Japanese encephalitis. Japanese encephalitis is a kind of
Conclusion. The infection causes in children a strong episode of fever and in severe cases seizures and unconsciousness. The identification of a pathogen can drive important support for treatment decisions, such as change in the immunosuppressive regimen or the use of patient treatments. Standardization of protocols and analysis will aid in the development of this approach for the treatment of such patients.
So in 2009, I started acting erratically and out of character. And
Thank you.